Hello. Over the next few minutes, we're going to explain how to fabricate our RAPID appliance. A RAPID appliance is a duplicate of an existing hybrid or temporary denture. For instance, if a patient had an all-on-4 conversion and now it's time to go to the final restoration and the patient is wearing what's approved. In other words, the tooth position is right, the vertical is right, patient's happy with tooth display, and overall the prosthesis the patient's been wearing for the past several months is approved. Or perhaps there's some minor changes, not major but minor changes, midline shift, maybe a little bit more tooth display, add a little to the incisal edge, and perhaps even open a little bit, then the RAPID appliance still works. So just bear with us over the next 5 minutes or so and we'll explain the entire process.
Our very gracious patient is Sally, who underwent an all-on-4 surgery months ago and is now ready to restore. Her only complaints are, number 5 is a little prominent, and there is some space, some overjet space in the areas of 9, 10, and 11, which we can simply correct. It's important to note that once the hybrid is removed, if the patient has transmucosal abutments, then they can simply just wait while the RAPID is being fabricated. If you are going to the implant level, you may want to seat some healing collars so that the tissue does not collapse on the implants. While the patient waits in the chair, the hybrid is taken back into the laboratory where we begin the process of making the RAPID appliance. The first step is to add the analogs so that a new model can be fabricated. Hand tighten all 4, in this case, all 4 analogs to the prosthesis. Use rope wax to border the prosthesis right at the gum line. Use excess rope wax to create border extensions. In order to add second bicuspids or first molars, we need to capture the land areas of the posterior ridges. Use buff stone or quickset stone to make a model, bringing the stone up and around the sides of the wax. Trim the stone model, smoothing around the edges. Try to relieve any stone that's covering the wax. If the wax comes off, that's okay, it can be replaced. And now we have a model that has border extensions. Next, using putty and accelerant, create a matrix that will be molded around the appliance down to cover the stone. This will be used as a matrix to fabricate the new acrylic duplicate. Once the matrix is removed and the hybrid is unscrewed, you can see that we have a new model with replica analogs to exactly duplicate the position of the transmucosal abutments. The next step is to attach the temporary cylinders to the replica abutments. The temporary cylinders are the exact same type that have been used in the prosthesis in the mouth for the last 4 or 5 months from the conversion of surgery. The matrix is tried on after each temporary cylinder is screwed down to see if they need adjusted. Frequently, they are too tall. Generally, the temporary cylinders are too tall and must be adjusted. If they are not adjusted and the RAPID appliance is tried in, then frequently the patient's opposing dentition will contact them and the bite will be compromised. So after each cylinder is tried in, place the matrix back on the model and test to see if you can close the matrix all the way down. Once all 4 cylinders are in, then the matrix can be used to create the RAPID appliance. Once the final temporary cylinder is screwed down and adjusted, use a lab knife to remount the insides and even a burr to grind the outsides of the cylinders where they're adjusted to remove any burrs and sharp edges. And then remember to remove any sharp edges of stone as well, so you have a smooth surface. Place separator on the entire surface of the model, including the sides. Then, with a Sharpie, make a mark where each of the temporary cylinders is located, and then fill every temporary cylinder with Teflon tape. Completely fill the pressure pot with water. Now we're going to create the RAPID using standard acrylic, and as mentioned before, you can use any color, pink, white, whatever you have available. Thoroughly mix. Then fill the flask or the matrix with acrylic, and at this point you're going to let it stand for approximately 60 seconds. What you're looking for is a low viscosity consistency. You can see as we're pouring it, it's still a little bit too runny. It should start to have a low gloss appearance. At this point, you reinsert the model back into the matrix and squeeze and hold firm until acrylic begins to express around the borders. Place at least 4 heavy-duty rubber bands around the entire flask. Place it in the pressure pot. Fill the pressure pot completely to the rim so that you have a seal. Tighten it down. Once the acrylic is cured, remove the flask from the pot. Then use a round burr to open up the channels to the screws. Remove the Teflon tape. Remove all the screws. Separate the model from the appliance. Clean up any flash. Make it nice and smooth. Be sure to relieve a little bit of space underneath for impression material. And then use a straight burr and drill holes through the appliance for the small tip on the light body impression material to fit through for the pickup impression. Then we will section the appliance between all of the implant sites so that it can be duralayed in the mouth. Screw it back down the model, make sure things look right, transfer it to the mouth. Once all the sections are hand tightened in the mouth and in their proper rotation, connect them all with acrylic, followed by equilibration. Tap, tap, check, make adjustments, making sure that the prototype, the RAPID appliance, is seating the same as the hybrid that the patient's been wearing. Then capture a bite, and then finally we're going to capture a pickup impression. So be sure to use tray adhesive under the appliance before you place it in the mouth. All these ports are now injected with light body material. This is normal impression material technique here. And once it's set, remove the appliance. And here is a RAPID appliance, and send this along with the models, the analog model, the opposing, the bite registration, and photographs to Road Dental Laboratory. Full smile, and relaxed smile, and a close-up are ideal images for this type of case. Thank you very much for watching our RAPID appliance fabrication technique.